So welcome to today's 2022 New Hampshire PATH Virtual Conference. With that, I'm going to hand things over to Mandy Reagan with the New Hampshire Department of Health and Human Services. She's going to go ahead and give a little welcome and introduction today and just answer any other little questions you might have as we go, and then we will get started with the PATH 101 training. So Mandy, I'm going to go ahead and turn it over to you.
Good morning, everybody. So Mandy Reagan, as you know, Bureau of Housing Support. So just like you all, we wear many hats here at BHS. My hat for today, though, is State PATH Contact. So the whole conference here today was made possible through a grant from SAMHSA for the PATH program. So you're going to hear a whole lot about that in this first session here. But I do just want to emphasize that while the content is geared towards PATH, as that's the funding source, there are many, many things throughout the sessions today that will be applicable to any of the providers that are here today. Very excited to see a diverse group. I think that'll be great for discussion and questions. And in terms of the agenda that you see in front of you as you went into the lobby, know that there are breaks after each session, and that is by design, right? We know you all are very, very busy right now. Winter is here. You're pulled in 1,000 different directions, but the breaks are put into place so that you can then answer emails or take phone calls or talk to colleagues to allow you to be present in the sessions. We want you to be here and be engaged and really take the time to hear the content. So with that, I think I'm going to turn it over to our presenters for the day, Advocates for Human Potential. I'm very excited to have them here throughout our journey today.
Thanks, Mandy. Hi, everyone. I'm Michelle Baxter with Advocates for Human Potential. I'll be doing your first session, which is PATH 101. And Tony, could we go forward to the next one? So we have a few missions on this. And just to give you a little bit of background, I was a state PATH contact myself for 7 years in Pennsylvania. So in our state, we had a lot of weird things going on. We had 16 COCs, up to 40 providers, and we had 9 different HMIS systems. So if something could happen, it probably happened in Pennsylvania and we had to troubleshoot it. So today I'm using all that background and I've put it into a presentation for you so that I hope I give you the basics, but then also give you some of the important things to make sure you keep paying attention to throughout the year. We will touch on legislation on which everything is based, and we'll start from that perspective. We'll go into giving you some tidbits on the HMIS system for PATH providers, some things that you need to make sure you're doing to get proper counts, etc. Give you a general outline for the activities throughout the year, and then I'll give you a few resources. One of the cool things about this presentation is you'll actually be able to use it again, either as a reference piece or also as a training tool. So this, I think, has longevity for you, and I hope you enjoy. Tony? All right, so in our chat, you've said who you are, but could you also give me your roles? Because I'm kind of trying to scope the things that I verbalize throughout this presentation to the appropriate target audience. So if you could tell me, are you an outreach worker? Are you a supervisor? Are you an agency lead trying to understand PATH more? Maybe give me an idea of what your goals are with PATH 101 today.
And just to support you a little bit, there are a few that dropped in there. So we've got some management, we've got some outreach team, we have, outreach, peer support specialist, clinician, program director, community director, and outreach worker. So we're starting to see a lot more of those in here.
Excellent. Thank you, everyone. Okay, if we could go to the next slide, I'll keep checking out the chat, make sure I haven't missed anything. So as I mentioned, the basis of PATH, the base of everything we do for this grant is coming from the legislation. This is the why behind everything that we do. Next. PATH is officially spelled out to be Projects for Assistance in Transition from Homelessness. You'll hear me refer to it the rest of the time as PATH, obviously. And this was a grant authorized by the Stuart B. Kinney Homeless Assistance Act and was re-ratified in the 21st Century Cures Act. The interesting thing, or one of the interesting things, because PATH is very different in many ways, is that PATH is a formula grant. And for those of you who may or may not understand formula grant, there are competitive grants for which you actually have to compete against other people's ideas and programming, and there's a formula grant. So formula grants are grants that are, in theory, there every year as long as you do everything that is being required by the grant. The amounts are formulated by the government and given out to us in that manner. The money does come out to your state PATH contact, and then that is distributed from the state level down to the provider level, whether that is through individual counties or individual providers, and there's typically a contract involved. Next. The goal of PATH is to reduce or eliminate homelessness, but also to give an increased level of living, maximize the potential for someone's situation for those people that are living with serious mental illness or co-occurring serious mental illness and substance use disorders who are also experiencing homelessness or an imminent risk of becoming homeless. I kind of challenge any of the other grant programs, and this might sound a little odd, but this is a very difficult population. This is not a group that is willing to give you a ton of information up front and be open and say, sure, I'll go ahead and do that. And you're going to find, as we go through different parts of today, that this particular target audience has made PATH's workflow slightly different. Also, these PATH funds have a different menu of items. I believe there are 9 static items that you can use the funds for. Not every single provider needs to provide all the different types of services, but we try to match the services that are most appropriate for the needs in your area. Overall, PATH is focused on 2 things: street outreach and case management. Those are the foci for this program. Next slide. As we mentioned, the legislation is where we base everything. And so our legislation specifically spells out, and you'll see it in our chat, in the Public Health Services Act, that the homelessness individuals are suffering from serious mental illness or SMI and substance use disorder and experiencing homelessness or at imminent risk. Now, when we talk about what counts as SMI and what counts as a substance use disorder or what counts as experiencing homelessness, PATH is slightly different. Serious mental illness is defined by each state. So each year when Mandy turns in the application for the Projects for Assistance in Transition from Homelessness grant, she has to give a state definition of how your state understands serious mental illness. When I say that, I mean, typically you're looking at your access to schizophrenia, serious anxiety, things of that nature. And the state will decide whether or not things such as PTSD fall into the SMI. You also can look up characteristics of serious mental illnesses on the Blue Book from SOAR program, SSI, SSDI, Outreach Access Recovery. And you can also look at the DSM-5 to get criteria. The big thing with the big thing with PATH is that primarily you have to have a serious mental illness. And it makes sense because this is sponsored by SAMHSA. So keep in mind, if you do have a co-occurring disorder, that the serious mental illness needs to be the primary. And as far as experiencing homelessness or an imminent risk, there are a whole bunch of things that factor into that too. PATH overall is written in a more relaxed manner than a lot of grants to give it malleability. And for us, we understand that the big funders out there, they're going to focus, for instance, your COCs are the biggest source of funding, and that comes from HUD for homelessness. And they're going to focus on the hardest people because their application is weighted. The harder the population that they are addressing, the more money they get. So there's a balance here. While that group may or may not have those people at imminent risk of becoming homeless, PATH can pick up those people. Also, with the larger funding sources, there are limitations. You can't use it for people that are involved with the criminal justice system, for instance. So PATH is a little different in that way. And just to give you an example of what I was trying to explain there, if you have a mason jar and you fill that mason jar up with rocks, it's pretty full, right? You know, it takes up most of the spots in that jar, but there's still some cracks and crevices that aren't counted. That's very similar to the large funding stream from HUD. It covers the majority of what's in that jar, but not quite everything. Well, if you take some sand and you pour it in on top of those rocks, it fills in all the spaces and the air bubbles in there. And that's what PATH is. So you'll find when we're going through the legislation that PATH is written in such a way that we have some malleability to take care of the things that the other big money doesn't, but we're only a very small amount of funding in comparison. Next, please. When I mentioned that there were allowable services, you'll see on the right, the blocks with the different types of services that are available. And as I mentioned, not every provider needs to provide all of these, but we should be definitely looking into street outreach and case management. We'll go on to the next one. So with anything, there are always some special rules. And for PATH, we have some special rules that come with the things that you see listed here. You'll see a common denominator. All the things that you see down below typically have an exchange of cash on behalf of the enrolled individual as their common denominator. What this means is if you look at the 20% max housing guidance, this is something written into our legislation. We'll see it on the next slide, but these are things that of the federal funding, and PATH gets two types of funding, federal and match funding, that we can only spend 20% maximum of those federal funds to accommodate the different things on your screen right now. If you have questions on that, let me know. But as I mentioned, that is something that we actually have in our toolbox. It was the 20% max housing guidance that will be coming out into the chat and also is available on the initial page, is something that was created by a nationwide group of state PATH contacts called the State PATH Contact Network. This group had convened, and their basic goal is to make PATH better from an SPC's perspective. So people will come back into their meetings with their state SPC. The SPC then comes to these national meetings and they talk about, hey, you know what, my people are really struggling with what this is, or they need guidance on this or this. And so we have subcommittees on this group. And one of the subcommittees was the 20% max housing. I was on that committee actually, and we made a lot of revisions to this, but you can see from this document, it's a great reference piece, and I highly advise reading through it because that will save you hassle. And if you have a site visit, that will definitely give you an advantage because you know that you're spending your money correctly. One other thing on this 20% max, I will say from the experience of having a SAMHSA site visit to the state level, is that SAMHSA will absolutely want to have very distinctly spelled out proof that you're not going beyond this 20% max of your federal PATH funds for anything on that previous slide listed as housing. Next. Oh, Mandy, did you have something you wanted to throw in?
Just one thing, just as context for the state of New Hampshire, we received $300,000 for those that don't know for this PATH program. So in terms of housing costs, the PATH is not the program in New Hampshire to have those costs. So $300,000 has been that formula grant since 1990. So case management and street outreach in particular is where the heavily invested dollars are. So although we would love to have housing funds for PATH, 300,000 does not go very far, sadly.
Excellent. Thank you, Mandy. Appreciate that. So there are some other rules also for things that are listed in the PATH legislation. Overall, PATH funds can't be used for certain things such as supporting emergency shelters or inpatient anything. We can't pay cash payments to those that are enrolled in PATH because you know Bob Smith needs an extra $20. You can't give him that $20 to make it to whatever bill he has that he needs the money for. Anything that PATH is helping to pay for must be done within the PATH reporting period. So it can't go beyond the project period if you're trying to help someone with a lease or titrate or anything of that nature. And as Mandy said, that isn't going to be something you guys are typically doing, but just as an FYI from the legislative standpoint. Next. So match is an interesting thing in PATH. And when I was the SPC, we had a lot of people that didn't really get the match, but let's try to break this down. So for every $3 that we have in federal funds, there needs to be a $1 match for PATH. And Mandy, help me out. Your match is provided by?
So the PATH providers provide a percentage of it, and then the state provides the remainder.
Okay. So for every $3 in PATH federal funds that are drawn down, there needs to be that $1 match. And I kind of do the demonstration like this because it has to happen as you use the funds. So if you're going through the year and you get to the end of the reporting period and you've spent all your federal funds but have all your match, that's not going to fly. You need to actually pull down the match at the same time as you're pulling down the federal dollars. And where that can really come into an interesting thing is if you have carryover, because then that's handled in a completely different way according to your SBC. And Mandy, I'm not sure how carryover exists in your state, but just so you know, if anybody were to come and visit, there will be a need to show that you are pulling these funds at the same time as you go throughout the year. And the good thing is you can't, as a provider, because Mandy's saying it's partially the state and partially the provider, you can't be asked to meet more than that. This is the requirement from the federal government for the funds that are given to you. So this is not something that can change at a whim. So you know that this is a static for you. Next. So our annual reporting, I don't know, you might be familiar with that right now. Not sure why. This typically occurs between October 1st and December 31st. And for PATH, this year, it's kind of interesting. We have a lot of changes going on with our PATH data exchange, or PDX as we call it, which is where we upload our HMIS information for the reporting period to return to SAMHSA. But in general, know that it typically occurs between October 1st and December 31st. And, you know, I throw this out there because as an SPC, and when I had as many providers as I did, I wanted people to not doubt why I was asking for things by a certain date. So your SPC may have other deadlines that she needs to meet for other grants. Mandy obviously does more than just PATH. So keep in mind as well, when Mandy has to sit there and look through everyone's report, she needs to build in time for her to be able to review the report as it is, ask for any questions to be answered, or ask for any additional information or corrections that need to be made. Then she needs to recheck that information, then verify to SAMHSA, and then send it on. So there are a lot of steps that may not be obvious to a provider level that the state needs to do. And we want to make sure that everything is as accurate as possible to give you credit, because you guys are out there busting your butts. You're doing a lot. And we want to make sure that you get credit for everything that you are doing. So to do so, we use the HMIS system. We're going to go over a lot more details in the HMIS system, our Homeless Management Information System. And know that for your state, your reporting year is based on July 1st through June 30th. So you could actually, because of your reporting year, get a head start. So if on July 1st, you want to run a report and check your numbers and make sure that things are kosher, like you put in this and you're expecting X number of people that you contacted and your information, your report's not showing that. Well, here's a chance for you to rectify any discrepancies that you might have and update your information and make it as accurate as possible once it gets to SAMHSA. And I say this because SAMHSA takes our annual reports and goes to Congress with that data and says, look, we're doing something. We're doing great work. This is something you should continue funding. So the more accurate the data is across all the states and across all the programs within a state, the better the case that they can make to Congress for those fundings. And each year, as I mentioned, we go into PDX, which are going to have some few updates. So just, this is the updated link when you get this version of the PowerPoint, but just make sure you note any difficulties or any things that you really like about the new PDX system and share them with Mandy so that it can be passed along to make this as easy an interaction for you every year as possible. Next. So as I mentioned, there's that application. So obviously, you know, as a rule, as a piece of the legislation, yes, we want you to apply for the funds. Part of this is telling SAMHSA what you're going to do with the money. So we receive, as a SPC level, a funding opportunity announcement from SAMHSA that says, hey, the PATH application period's open, come on. And from what I understand, SAMHSA is threatening to have this out even earlier this year. So they're looking at potentially January to get this out. And I'm quite amazed by this, in all honesty, because in my time, we would get the funding opportunity announcement even as late as May, and it was due in June or July. So keep in mind that you can update your information for your part of the application, which is the intended use plan, throughout the year. If you have changes, you know, just go ahead and make that update so you're not rushing at the last minute. But keep in mind too, that we have a grand total of 8 weeks from the day that announcement comes out from SAMHSA until those pieces are due back to SAMHSA in the form of a report. This is a lot of work, again, for your SPC, because Mandy has to sit there, read through all these intended use plans, which are telling her how you plan on spending the money and using it to benefit our target audience. And she has to make sure that all the topics that are listed in the funding opportunity are addressed in that, as well as anything that is coming from the state's perspective. So if you're one of those people and you read the funding opportunity announcement and you're looking and saying, okay, it says this is the IUP, keep in mind that there are other parts of the application that you don't see. The SPC is being asked to, and I think we're up to M now, A through M, additional things, topics on which the SPCs need to report. So you might have some additional questions that are sent out to you in a template form, per se, to collect other information that she needs to do the actual report up to SAMHSA's level. And on a good note, SAMHSA said, you know, this is a lot of work. So to make life a little bit easier, make the reporting burden a little bit better for everyone, in 2019, they started doing the biannual application process. And what this means is you have a full-blown application one year, and then the following year we have a mini application. And by mini application, don't get too excited, we still have to do every single year a budget table, a budget narrative. Every single year you have to do both of those. But if you have no changes in your programmatic structure, You haven't changed your provider. You haven't changed how you're using the funds. You haven't made any target changes in your area or provide any different services. Chances are you'll be able to click on a box that says no major changes and only need to worry about the actual budget and budget tables. Anything you want to add to that one, Mandy?
Just that we're on letter N now instead of M. A little further
N
along.
as in Nancy, yeah. So there are a lot of things that for those of you who are looking at that FOA and saying, but this is all it says there. Yeah, there's a reason that Mandy might be asking you for some extra tidbits of information. All right, next. And finally, legislation does not officially say you have to use HMIS. Let's just say this is SAMHSA, who will say it's strongly encouraged that you use your HMIS system to do your annual reporting and to collect data throughout the year. The product that is used for your annual reporting and for your consistent updating of the services and referrals and all the activities that you're doing with a person is chosen by your continuum of care. I know that seems a little odd, but that is just how the system's set up. So your HUD, Housing and Urban Development Continuum of Care for your area, is who chooses the product. Now, when I say product, imagine going to a bookstore and you're looking up on the shelf at that bookstore and you're like, oh, there's a book I want. And you take it out. That book, as it stands from the bookstore, is the product. So that's the HMIS product. Now, just like a book, if you open that up and you start making notes on it and folding the pages and highlighting this and that, now it's become modified for your use, for your purposes. This also happens with an HMIS product within your continuum of care. So be careful. There are differences in products, even within the same state, if they have different COCs that are using different products or different versions of modifications of the same product. And with this data collection, PATH has some program-specific data elements that must be collected, in addition to what I commonly refer to as the generic things. Things like the Social Security number, your date of birth, your sex, your history with enrollment in the military, et cetera. All these types of things are your basics, but then we have program specific, such as where you're living and how long you've been in that situation. What are your co-occurring factors with that experience with homelessness, et cetera. And we require that you collect all this information, even pre-enrollment. This could get sticky for some of you because I know that nationally, as I'm working with different states, some people are like, but we don't put them into HMIS until they're enrolled. Please know that there's a great distinction between entering someone into HMIS and entering them into enrollment for PATH. They're not the same. Just because you're in HMIS does not mean you are enrolled in PATH. So please understand that difference. We need you to collect the pre-enrollment data because SAMHSA wants to, again, use this information to take back to Congress. So when SAMHSA is trying to make a case for, hey, this is indeed a needed source of funding because this particular target audience is not being met by other grant programs. And look at how many contacts, if you look at question 12A and 12B on your annual report, look at how many times we had to interact with someone to build that relationship, to gain that trust, to get the actual information that is needed to make a determination on whether or not someone is eligible for the PATH program. We need to keep this data collection and we need to keep all the contacts, especially collected throughout the entire time that we're working with someone, from the day they're entered into HMIS through the time they exit or the end of the reporting period. We're going to get into a lot more detail on that sort of thing, but just know that HMIS should be used to collect your data on your PATH activities, even though you have an electronic health record system. Anything you want to throw into that one, Mandy?
I just want to make sure we highlight the New Hampshire PATH or the New Hampshire HMIS, so many acronyms, vendor here in New Hampshire is the Institute for Community Alliances, ICA. We are very fortunate to have 3 COCs, but all 3 COCs do use one system, thankfully. So they are here on the call today for any questions as we go through. But I think everybody here knows who they are. I think Robin and Shirtina are here, so just wanted to highlight them.
Excellent. And it's very important to know that these people exist because, as I was mentioning earlier, when you're trying to, on a smaller scale, on a monthly, bi-monthly, quarterly, whatever time frame, rectify your information and make sure that it reconciles against what your paper or what your electronic health records has, it's very important to be able to work with this group of folks because they're the ones that are going to be able to help you. Okay, so we've gone through our first section. Are there any questions before we get into that homeless management information system section?
And this is the point where if you do have a question, we do have a small enough group that you can feel free to raise your hand or just come off mute or drop it in the chat. And we did drop all the files so far. We'll continue to do so as we go along. So if you have any issues downloading those files, just let us know. But at this point, I don't see any questions.
Okay, before we go on to the next, I do want to mention, I see that the definition of homelessness is in the chat for you. And when we're talking about the target audience for PATH, please understand that our target audience, if it wasn't very clear, is much broader than what others might have. Again, because we include those experiencing homelessness or imminent risk, there are a lot of factors of imminent risk that you might not recognize as being applicable to the PATH program. For instance, it's not necessarily meeting the HUD standards of X, Y, or Z, but we're able to take people that are in Section 8 housing, SSVF housing, or other funded housing. Why? Because if that funding source disappears, which as we've seen during the times of COVID is, potential for funding to go to a different area, then that person or those people would be then experiencing homelessness. So for us, imminent risk is slightly broader. And if you read through that particular piece from 2018, it gives you the guidance on what PATH and SOAR focus or typically employ as their definition of homelessness and imminent risk. All right. Workflow. All right. For those of you who are not data hounds, I'll try to make this as fun as possible. One of the things with PATH is we're a weird bear. And I say this as a strawberry blonde, we're the redheaded stepchild of grant programs. Why do I say that? It's because we do things very differently. Our workflow reflects that. So as I mentioned earlier, we have a very, very different task at hand when we do outreach. We are trying to reach that population that is not the most trusting. They are experiencing homelessness. They are on the street for a reason. Something happened to them. Somehow, most of them will probably be feeling distrust or cheated by something or somehow ending up in the situation they are and not being, oh yeah, my name's Bob Smith. Here's my social security number. Here's this, here's that. And you can have all this the first time you talk to me. It probably isn't happening. And I hope I see a lot of heads shaking with that because it's just not that easy in the general population. So PATH understands this. SAMHSA understands this to the point of there are many things written into the SAMHSA HUD PATH HMIS manual on the federal level that says, hey, PATH is different. You're going to have to deal with this. And if any of your COCs have different workflow ideas, a lot of times it's just a communication issue. It's again, HUD has this much funding, PATH has this much funding, but PATH tends to require just as much time and effort on the HMIS side as the big funded grants. So a lot of times we need to do a little more explaining as to the why behind our program. And because we are outreach engagement primarily, again, that's a little nuanced. So we have engagement and date of engagement versus what other programs might typically have is you meet someone, you enroll them right away, and you move right away into the next section. So as I mentioned, we need to make sure that everyone's on the same playing table, that we have all the understanding and we can reference all the different things in the manual so that we can have these easy communications. There is a YouTube video that we're not going to watch today, but it's really cool that it'll give you tons of information on how to employ the PATH workflow, which is very different from others. Next. Anyone that knows me will know this is one of my favorite graphics of all time. This is the PATH data collection workflow in visual form. As we go through a lot of different elements, I'm just going to highlight some things. So for instance, project start for PATH is literally the first time you meet them. The expectation is the first time you meet someone, you do come back, you start to put them in HMIS and know that you don't need to have a Bob Smith and everything ready for them. This is your first contact. So you're going to do your initial assessment in HMIS, and you're also going to be choosing into which project type you're entering that person. You'll get quizzed throughout this little presentation, but there's one way to choose which project type into which someone goes. You ask the person, where did you stay last night? And you use their answer to choose. If they say they were staying in a place not meant for habitation, they go into street outreach project type. If they say they are staying in a place meant for habitation, then they go into supportive services only project type. I caution you on putting too much emphasis of the name, the nomenclature used for these project types, because if you say street outreach to a PATH worker, they're going to say, oh yeah, I did street outreach to meet them. That's where they go. No, again, keep in mind, we need to focus on where they stayed last night. Just to give you a little history, HUD was using HMIS a long time before a lot of the other SAMHSA and federal partners. So when all the other federal partners are like, hey, you know what, that data thing, that's probably a good plan. We should all be doing that. They're like, HUD, you've been doing this the longest. Why don't you be in charge of all the nitty gritty and telling people how to program and all that sort of thing? So they did. And that was fantastic. It's good to use the person that has a lot of experience to lead that effort. But in doing so, when I mentioned, remember, PATH's a little different, we can use the same exact word and mean 180 degrees different from another program. And unfortunately, when HUD names different things, such as the supportive services only and street outreach project types, that clicks us into a certain mode in PATH that isn't necessarily in alignment with what the actual goal is for that. And this is one of those examples. Just because you find someone during street outreach doesn't mean that they stayed in a place not meant for habitation. They could have been in a place meant for habitation the night before. So after that first contact, you go into what we call engagement. And this is where a lot of the confusion comes in. For us, engagement can be any length of time. The point of engagement for a PATH program is to find out the information that we need to, as you see it between 2 and 3 in that little circle, be able to make the PATH eligibility determination. Are they experiencing homelessness or are at risk? And are they experiencing at least an SMI, if not an SMI and SUD? And then also the factor of, we ask the person, would you like to enroll in the program? And they need to agree to that. For us, this engagement period, I mean, let's face it, you might get a name. It might be a real name. It might not be. you might have to go into your project start, and it says this in our HMIS manual, and give them a fake name. Give them whatever naming convention you can. Bob Blue Hat on the corner of 5th and Main if you need to start that activity, because SAMHSA needs all these contacts collected from day one. So during the engagement phase for us in PATH, yes, we're looking to collect the universal data elements and the program specific data elements, but this is where our relationship building happens. This is where we engender trust. This is where we get people to open up and really give us honest information that we can then go back and make that eligibility determination. One way that I like to explain the difference between PATH and some other programs is that engagement for us is that long section in the blue, but date of engagement is the actual day you make the eligibility determination. So that might help you differentiate a little bit. And then we move on into, if the person agrees and they are eligible, into the enrollment. And by this point, we should have all the universal data elements and program specific data elements, and then move on into project exit. But please note that we do need to get credit for our contacts the entire way through. We're going to go into how to do that in a few coming slides, but any questions on the data flow itself at this point? Okay. Can we go to the next slide then, Tony? I mentioned before that our HMIS manual actually says, hey, PATH is a little different, even in the HMIS manual. So one of the ways that they note that is in this section where they note data collection challenges. They're pointing out that, hey, this is street outreach. This isn't everything in one shot. You can, depending on how your project is set up and how your, for lack of a better term, feeder line or referral process is for your program, you might have people that are pre-qualified that come to you and are eager or in the right mindset to want the help that your PATH program can give them. And you may very well meet them and be able to enroll them the same day. In the typical mindset of PATH nationally, that probably isn't going to happen, but it could. So what the data collection challenges is saying, hey, look, it's going to take collection of data over time and updating that data over time to be able to get the complete information we need. And as I mentioned in the next 2 points, you can make up a name, whatever naming convention you want to use, as long as you can then identify that person. The thing to really point out here is if you do start with a made up name, obviously you can't search that person to see if they're already in the HMIS system. So once you get to a point where you have the key elements with which you can differentiate that person, their name, their social security number, their date of birth, their veteran status, if they are enrolled in PATH, you then need to go back and reach out to your HMIS folks and say, I need to reconcile because this person is actually this person, but due to the PATH workflow and our engagement process, that information was not available at first, and now I need to reconcile this and combine these entries into the HMIS system. So if you figure out that Bob Blue Hat actually is Scott Smith and Scott Smith was already in the system, that's when you'd have to do that. All right. And I'm just curious, anything from our HMIS folks on the line that you want to throw in here as well?
No, great job so far.
Okay. All right. So as I mentioned, we have some definitions from the PATH HMIS manual. For us, project start is, as I said, that first day. Literally, it's the first time you interact with someone. Engagement, as I mentioned, is the blue section, and that's where we're supposed to collect all the information until we get to date of engagement, which is the day that we make that determination. Enrollment, obviously, is when you can determine, based on the information that you've acquired from the person, if they are eligible And if they agree, you can then enroll them into services. Now, Robin, I'm gonna ask you a question here, because one of the things nationally that we see is that because of the different COC data check processes, that sometimes PATH workers are told, you need to put everything in, you need to put everything in. But we're still in that engagement, that blue section of the process, and we aren't to the date of engagement yet. Do you have any feedback on how your system uses the reporting checks from the COC perspective and how you rectify correlating that with PATH?
So that's what we teach in our workflow too, is not that you need to have all of the information in there right away. Yeah, that's and we have all of this information on our ICA website. We have trainings that we do for how to do the workflow and PATH, and we have our help desk that we're always answering questions with too. So that's exactly how we teach it in New Hampshire. Yep.
Oh, Robin, I need to clone you. That is fantastic to hear. This is that, and I'll tell you, providers, that's fantastic, because that is an uphill battle for a lot of states, because there is not that understanding about PATH being the weirdo program compared to others. So wonderful. I'm glad to hear that, Robin. Next slide, Tony. You just took out like 10 minutes of conversation by saying that you're already understood that. That's amazing.
Glad to help.
When we talked about defining contacts and defining different words that we went through the slide right before this, contact in PATH is very important to understand, because you don't want to be putting in that you're getting credit for a contact when it wasn't really a contact. Because if you say you had so many contacts, but then your outcomes don't reflect percentage correlation that seems realistic, it's going to make you look bad. So making sure you have a proper understanding of what a contact is going to help you. So a contact for PATH is an intentional interaction between you and the potentially eligible person or the enrolled person in PATH. It could be short, it could be long, but it must include the presence of the person, and it can occur anywhere. Different settings. Now, I say that cautionally because I believe, Tony, if you take us to our next slide, because of circumstances over the past few years, because, that pandemic thing came along, there are exceptions to what standards SAMHSA had previously set up. SAMHSA wants you to have face-to-face interactions before it counts as a contact. But your HMIS manual has this nice little section here where it is saying, hey, there are exceptions, like during emergencies, disasters, and pandemics. The thing I want to point out here is that these emergencies, disasters, et cetera, need to be presidentially declared. This isn't declared by your agency, your boss, your state even. These need to be presidentially declared because this is a federal funded program. If it is under that circumstance, which we are now living in that, anything that you do with a client via telephone, web-based meetings, et cetera, can count as a contact. But please understand that once that declaration from the president is pulled back, there's going to be a little bit of a paradigm shift there, because we need to get out of that mentality we've been in for the past 3 or 4 years and understand that the expectation is to be a face-to-face interaction. Next one. Any questions so far on those few topics and definitions? Let me just throw one other thing in on contacts. When I say intentional, it needs to be forwarding the relationship. It can't, if you go to a breakfast for people experiencing homelessness and you put out a flyer on 50 seats, you don't count 50 contacts just because you put a flyer out. You actually need to have intentional interaction. You need to talk to them about PATH. You need to tell them what offerings you have. You need to get a little bit of feedback from the person. Handing out socks and not having any conversation after it does not count as a contact. Even though you've given them something, it doesn't equal that intentional interaction. So just to throw in that little clarification there. So we talked a little bit earlier about choosing project type. And if you work with me in the future, you will find me asking and quizzing and asking and quizzing. How do you determine project type? Because literally the change on how to do this came about right before the pandemic. So guess what? We were a little focused on some other things. So please understand that where did you stay last night? Ask to the person to whom you're outreaching, and using their answer, not your assumption of what their answer should be, is what determines their project type choice that first time you meet with them and put them into HMIS. Also know that whatever choice you make on project type, that person stays in that project type for their entire enrollment. And I throw it out that way because if you exit them from PATH for whatever reason and they come back into PATH, they might have a different circumstance for that enrollment in PATH. So please make sure you're asking the question using their answer and know that that stays the same for the entire time. Next. As we mentioned, if the answer is that they stayed in a place not meant for human habitation, that goes into the street outreach project type. And here are some examples that we have. Mostly these are going to be your street homelessness. Next. If they say they stayed in a place meant for habitation, and that can include emergency shelters, etc., that means they would go into the services only project type. Notice the last few things here. When we talked about what counts as imminent risk of homelessness, permanent housing program in danger of losing housing, or the rent is late, or their utilities are being turned off, all these are situations that relate to imminent risk of housing loss. So understand that if that is the case, those people also go into the supportive services only project type. Next. So if you happen to ask this question and you don't get an answer, because again, this population is not exactly really going to give you everything up front. If they don't tell you, you still need to put them into HMIS somehow. The question is, how long do you wait to try to get that answer from them before you go ahead and start the HMIS log for that person? This is one of the 4 data decision types from your SBC. Mandy, do you want to talk about your data decision point on this? This is generally reside is what the data decision point is referred to as. And again, that's one of those kind of tricky wording or naming on the HUD side, but how many days do you allow people to wait before they enter into HMIS?
Sorry, I was muted. So that would be 90 days. So consistent with the rest of the COC.
But this is before you enter them, not the auto exit.
Talking about, yes, auto
Sorry.
exit.
I was thinking it was a week.
So we don't have this defined. Robin, I'm looking to you because we just talked about this.
Yeah, no, we don't have this defined as far as I'm aware. There's no specific amount of time.
There's things to come, but there's nothing official yet. So
okay,
yeah.
So be looking for that, folks. When Mandy chooses that, and she as the state path contact has 4 points. And if you take us to the next slide, Tony, those 4 points are generally reside, re-engagement, auto exit, and aftercare. Generally reside was what we were just talking about. How long do you wait when you meet them if they're not telling you where they stayed last night so you can properly choose the project type? Know that if you don't get an answer, and let's generically say that Mandy eventually picks 7 days. So if it's 7 days and you still haven't gotten your answer, the default is to put the person into supportive services only. And why? Because putting people into supportive services only will have the least negative effect on anyone else using PATH data, because other people using PATH data tends to focus on the people that are street homeless or chronic homeless, et cetera, that would more likely fall under the staying in a place not meant for habitation or the street outreach project type for PATH. So if you don't have an answer within the number of days that Mandy will tell you eventually, that's your default. So as I mentioned, these are 4 SBC determined protocols for PATH, and it affects your data entry. The generally desired is what we just discussed. I'm going to skip re-engagement for now and go to auto exit. Auto exit, and a lot of programs have an auto exit. One, your HMIS system might not be auto exiting someone from the system. Auto exit in the PATH world means you are enrolled in PATH, the person goes MIA and you aren't able to contact them for X number of days. And at that X number of days, they're exited from the PATH program back to the last day of actual contact. So a couple key things there. They need to be enrolled. They need to hit X number of days, which I believe typically is 90 days. And I think that's what you were starting to mention, Mandy. And they're always exited back to the last date of actual contact. Keep in mind that might take you into the previous reporting period, and that's a whole other discussion, but know that auto exits after a certain amount of days. Did you want to say something, Mandy?
Just that we do not have that set up automatically in HMIS, as you were saying, but yes, that is the policy consistent with the rest of the COC.
And just while you're on re-engagement, and I'm sorry because my notes aren't up on this one, did you have that established at this point?
So we have 30 days. For
30 days. Okay. So for those people that are enrolled in PATH, there's a certain amount of time until they're auto exited, but the in between that is this bizarre area that we call re-engagement. So if they're enrolled in PATH, they go MIA, they have to be MIA for 30 days, but no more than 90 days. And that between 30 and 90 days is what we call re-engagement. This is why I skip back to it after auto exit. So re-engagement it's a shorter period. It's amount of time you have to be not in contact with someone, but before the auto exit. So that's what we call re-engagement, because you're actually bringing them back into the service. And then aftercare is the amount of time that your SBC will decide that you can continue working with someone once you've, say, placed them into a permanent housing situation. I kind of refer to this as the hot handoff, because you've built a lot of time, you've built a lot of trust, you have this person working with you. And again, not the easiest population to get that trust, et cetera. So when you're trying to transition them into the next step, you don't want them to fail at that next step. But if they have that bond with you, we need to get them situated so that they're trusting and establishing that relationship with who's ever taking care of their next location or their next circumstance, so that that person succeeds in that new circumstance. That's what we call aftercare. So the PATH workflow is not only affecting your inner report numbers, as I alluded to before, but it also affects other things both inside and outside of PATH. So this section is going to help you try to understand those little nuances and proper data collection. The first thing that the PATH data collection, as you're doing it, affects is the data quality. It also affects your PATH annual reporting numbers, your Government Performance and Results Act numbers, and the Housing and Urban Development System performance measures. Next. So as far as data quality, when we're talking about SAMHSA taking this information and then moving it up so that it can be used by Congress to continue funding, et cetera. There are 4 pieces of this that are very important. They're completeness, timeliness, accuracy, and consistency. We want our information to be as reliable as possible. We want everyone doing it the same way so that when we report information, it's as believable as possible. So when we talk about completeness, we want it, as we were alluding to earlier, to have all the data informations there. We also want all the notes. We want to know what happened. One thing that is very interesting is if you are reporting in HMIS, whether you do your notes there or in your electronic health records, if you wait a week between the time you have that interaction and the time you put that information in, do you think you're going to miss something? Do you think you might miss a detail that might be important, get a date messed up, something like that? So that's our timeliness factor. We want to make sure that our timeliness is there, but also that we have all the information for the completeness. Accuracy, obviously, is getting the information correct. And as we said, consistency is apples to apples across the board. When we were talking with Robin a little bit earlier, the completeness factor is one of the things that a lot of other programs nationwide are being harped on, for lack of a better term, by HMS because of that lack of understanding. You guys have a fantastic group and it seems to be working very well, and you are very blessed with that. I'm so happy for you. Normally we'd spend a lot of time going through that and explaining things, but we don't really need to. So we'll go on to the next one.
I just wanted to say too, Michelle, that we also have forms that match identically to the data elements that we have in HMIS. So those are all on our website. So you can print them out and bring them with you so that you have every single data point that you need to collect right there with you so that you can then put it back into HMIS when you get back to your office or when you have the opportunity.
Fantastic. And that reminds me, Mandy, I think I neglected to ask, do your providers use electronics in the field for their outreach, or do they do most things on paper?
So it really depends where they are. Some are able to utilize things like tablets or smartphones to be able to access HMIS that way. Some, like our friends in North Country, service is tough up there, so they're using paper forms. So it really depends. They have the opportunity, not always the access, I guess, up there in the woods.
Gotcha. I understand that. I grew up in cow country. And Robin, if you wouldn't mind putting the link to that website in the chat just for completeness when we collect the information here, and for anyone in the future that they have that would be fantastic.
Absolutely. I will do that.
Thank you. So, number of contacts in the path in reporting. First off, I need to make sure that you understand how to get credit for contacts. Remember back in 2019 when a lot of these things came into play and, we were kind of focused on pandemic or something. Well, one of those other things that was kind of an update back then was how you get credit for a contact in HMIS. The way to get credit for a contact is actually going into your interim reviews and doing an add update to the current living situation. And I say this because a lot of people don't realize, hey, I'm doing a service. Hey, I'm doing a referral. The system knows that's a contact. It'll give me credit for a contact. No, doesn't work that way. So HUD has decided across all the programs, the way you get credit for the contact is literally when you go in, just as if you're doing a service and you have to enter the service and then go in separately and enter your referral information, you have to go in and do an update to your current living situation, or you don't get credit for contact for that day. So yes, it takes a few extra seconds to do that, but it's very important that you get credit for contacts every single time. And again, before and during enrollment. Why? Because very succinctly, in questions 12A and 12B, this is where SAMHSA looks at level of effort. So this is how you're judged. one of the way you're judged. I'll put it that way. Question 12A relates to the instances of contact prior to the day of enrollment. So from that first in the brown section through the blue section, that's what we're looking at prior to enrollment. We want to know this because PATH in general and SAMHSA overall wants to know how much does it really take to get this particular population engaged and giving information and trusting to the point of being able to work with them on the different things that they need to get up to the life that is best for them at this point. So that 12A captures from that first time you meet them until they're either determined and eligible or enrolled. But 12A is collecting for those that did become enrolled, how many times it took to get to that point. 12B, on the other hand, is looking from not only that same portion covered in 12A, but then also adding in the time through enrollment. So a lot of times when I'm doing these annual report reviews, right before we send everything into SAMHSA, I might see that of 250 contacts, you ended up with 125 people enrolled. So that's going to say you had 2 contacts prior to enrollment to get them enrolled. This information can be interpreted a lot of different ways. If that number is small, we're going to be like, hey, you're going to end up teaching the rest of us what you're doing because that's fantastic. How'd you get this population enrolled so quickly? And that's where the comment section on PDX comes in, where you're going to want to kind of paint that picture and give some background so people understand the circumstances. The other thing could be if that number were very big, that's telling SAMHSA, yeah, it takes a lot of work to get that population trusting and moving in. And again, making a case to Congress. When we look at the number for 12B prior to and during enrollment, we're going to subtract out the number for 12A. So let's say for 12B, that same provider ended up with 1,500 contacts for that same 125 people. And now I have to do math. But generally, I think that that's going to come out to like 6 contacts per person. We're going to subtract out the 2 that it took to get them enrolled. So it looks as if you've had 4 contacts then from the time they became enrolled until either the end of the reporting period or when they're exited from PATH. We really need you to make sure that these numbers are accurately representing your work. Because if not, again, we're back to the data quality. And when we take this information to SAMHSA, who takes it to Congress, it might not show the actual work you're doing. I keep saying, get credit for your work. Get credit for everything you're doing because we know you're out there. We know this is not the easiest work in the world. And we want you to be able to continue it and help serve this most vulnerable population. Does that make sense to everyone? You guys are scaring me with no questions. Okay. So another way that the PATH data is judged is, next slide, please, are GPRA measures or Government Performance and Results Act. Every program is going to have GPRA measures. I believe this effort was started, I want to say 2010, if I'm not mistaken. And each program is going to have a bunch of measures on which they are graded or judged. For the PATH program in particular, we have 4 points that are currently being used. Now, keep in mind, GPRA measures are not static. This number could change. That number could change. We could have 10 GPRA Performance Act measures. We could have 2 in the future. We don't know. The numbers that are currently used in relationship to our measures could change. So if 57% is the goal for this year, well, it might be 67% next year. Understand that these are not static and they do change each year, and you could find them typically on the HUD website. So as I mentioned, these GPRA measures are determined each year by SAMHSA. PATH currently has 4, and the annual report actually collects 3 of these performance measures, and we'll go through those now. Next slide. The first measure is 3.4.15, the number of people who are enrolled in PATH that received community mental health services. Well, this is logical. PATH is mental health. They want to make sure that people are getting the mental health services. So of those enrolled, if you take question 16 on the annual report, divide it by 15, which is the total number of people enrolled, new and old, that gives you your percentage. The goal for last year and this year is 64%. This is something that comes from our HMIS data, and you will be able to see your particular percentage for each individual organization. 3.4.16, this relates to question 8 on your annual report. This, unfortunately, we can't break down into individual programs or individual states even. The national, including our territories, goal is 125,000. What you might be able to do with this is, if you know that last year, overall as a nation, we made the number, which we did. If you have an equal to or greater number of contacts that you did last year, this year, chances are you're doing your part. Now, obviously, there are fluctuations that can happen, but that's the best we can do as far as understanding, did you meet your part in that process? Next. The third measure is the percentage of contacted people who became enrolled. This relates to question 15 on the annual report. And question 15, if you have been with PATH for a while, you understand that everything else on the PATH annual report relates back to 15's answer. Either 15's answer is the total number that you can have for that section on the annual report, the maximum number of people that can be referred, the maximum number of people that can receive a certain type of service, the total number of different living situations upon exit, etc. So everything refers back to 15. For this, our total, again, hasn't changed, but could change between different years, was 57%. This is one of those places where I was saying, be careful what you count as a contact, because if you say you've contacted, had that intentional interaction with a goal of moving forward in a relationship of 10 million people, and you only end up enrolling 1 million people, it's not going to look good. So another reason to be careful about who you're counting as a contact versus not. The last measure, I'm really not sure why, but this measure does not come from our HMIS data. This number 3.4.20, this type of question has changed in the COC applications, but has not been updated in the PATH world yet. In this measure, we want to know how many PATH-funded people are trained to do SSI, SSDI, outreach, access, recovery, or SOAR. Now, the number of people that are trained to do SOAR doesn't necessarily correlate to the number of people that are actually using that knowledge and processing applications for whatever reason, whether there's not time or there aren't that many people or so security relationship isn't set up, whatever the case may be. The COC and HUD side has actually figured out that just knowing how many people are trained doesn't equal the real overall effect on the population. So the COCs have actually changed the wording on theirs to say how many people were trained 1 year to how many people provided SOAR services, and then it got to how many people were connected. Now, on our PATH HMIS data, we do look at the number of people connected to SOAR, and that is literally people that have at least started the PATH methodology, the SOAR methodology for accessing SSI or SSDI benefits, whether it's by a PATH-funded source or a non-PATH-funded source, and whether or not a person came into PATH with benefits achieved through the SOAR methodology. We get that through HMIS, And I will tell you that while this measure has not been updated, there is a group, a subcommittee. Remember that subcommittee we had for the 20% housing max? There is a subcommittee on the SPCN or State Path Contact Network that is looking into making recommendations to SAMHSA to change any of the GIPR measures and what parts of the GIPR measures they'd like to see changed in the future. Mandy, to my knowledge, there hasn't been an update to this? No. Okay. All right. So next. All right. So Robin, this is where you come in. You can fill in some blanks here if you'd like. The way PATH data relates to other systems, especially the HUD system performance measure, is through measure 7A, the successful placement from street outreach. As I said, we default into the supportive services only if a person doesn't give you an answer to where did they stay last night, because a lot of other programs, if they're pulling data from PATH, want the information from the street outreach project type because they're looking at successful placement from street outreach. And again, current living situation is how we're getting information recorded. And this is used for the coordinated entry system projects as well. Keep in mind that what you put into HMIS for PATH could affect the amount of funding that your COC gets or other programs. Robin, did you have anything you'd like to add to that one?
I don't think so.
Okay, is that concurrent with everything that you have in place then?
Mm-hmm.
Excellent. I'm so not used to this. This is fantastic.
Do you normally get different responses to these questions from your HMIS leads?
In all honesty, you seem to have an understanding of PATH that many HMIS level folks don't get.
Oh, great. I'm
Seriously.
glad to hear that. Yeah.
Again, because PATH has these little idiosyncrasies about different things, a lot of HMIS folks haven't understood the nuances and been able to adapt to them. They might say, well, yeah, PATH's different, but you still have to. And so a lot of PATH providers nationwide will get notices saying, your data's not complete. And we're like, we're still in the engagement stage.
That's the point. Yeah.
But unfortunately, nationwide, we want them to all be like you. So we might have to have you as a poster child. I don't know. But that's wonderful. Thank you. All right. Next slide, please. So guys, usually there are a lot of questions after the HMIS part, but you guys don't have any. Anybody want to throw anything in the chat? Any clarification at all?
Well, I mean, I do think that speaks to ICA, though. They really are very invested and very involved. And we recently had an HMIS training for PATH just a couple months ago. So they are wonderful. We're very lucky.
Excellent. Thank you. All right, guys. So now we're going to take a peek at a year in PATH. So if you're a new provider or if you're a new member of a provider team, this is why I've included this section. This kind of gives you an idea of what to look for and what to expect over that first year. So as you're getting started in PATH, there are a couple of things you need to do. You need to work with your manager and your state PATH contact. Make sure you're on all those lists. So if there's a listserv for X, Y, or Z, like updates to PATH or updates to SOAR relationship to PATH, whatever the ICA listserv. You want to make sure you're on all these so that you get any updates. As much as we'd love to say, hey, we're static, never changes. Well, that's not the way federal programs work. There will be changes, but make sure you get help getting set up in HMIS, which go Robin, that seems to be working very well. Make sure you look at the latest PATH funding opportunity announcement. And while that seems kind of weird and cumbersome, I'll tell you, if you sit and actually read the funding opportunity announcement, it gives you a lot of insight into how SAMHSA is thinking, because as I said, different aspects of PATH might be focused on. For instance, one year when you're reading through the FOA, it might say, especially the veterans population, or especially those experiencing criminal justice. And by watching how these sections are reworded or identified or not identified as being needed for applications, et cetera, especially in the parts that Mandy has to fill out, those A through N's, will give you an idea of, where's the focus going? What is SAMHSA looking for from the PATH program moving forward? Also, talk to other PATH providers, and you probably get a chance to do this if you have statewide calls, or like this, when you have a conference, use the time in between, message people. But everyone has a situation that they can probably help you with. Whether you're a rural provider, you need help with rural issues, you need urban issue assistance, or if you're just having trouble with the topic of outreach and engagement, or you're having trouble with PATH, HMIS, whatever the case is, reach out. If other people are doing it, they might have some tips and tricks that they've learned along the way to be able to help you. Essentially a mentor type thing. Obviously, get to know all the resources, and we're going to go over some of those next, and ask questions. If you can't tell, I was one of those kids that sat in front of the class and said, huh? Explain that again, put it in different words. Don't be afraid to do that, because this is a different program. If you've dealt with ESG, or you've dealt with runaway and homeless youth, or you've dealt with HOPWA, you haven't done PATH. Unfortunately, it's just, there are differences in this program that sometimes you just need to talk through with people. So next slide. Activities throughout the year. Well, obviously you're going to be entering information to HMIS, and depending on what time of year, and again, SAMHSA is saying that in January, if we want to go from that aspect, you're going to have the application coming. So you're going to probably have 8 weeks of your time that are going to be focused on getting that intended use plan done to say how you're using your money. And then as you go throughout the year, chances are you're going to have some site visits from your state PATH contact. They're going to come out and just see what's going on, do that litmus test. And by the way, please don't be afraid of these. These are not something that are like, the state's coming to get me. No, this is trying to figure out, hey, what's working well? Hey, what could you use some help with? Hey, maybe you could help this place because you seem to be doing X, Y, or Z really well. How can we look into these different aspects? Throughout the year, you might also have calls going on. We aren't currently doing the statewide call in New Hampshire, but that doesn't mean, if you approach Mandy and say, you know what, I've talked to so-and-so and so-and-so and these other providers, we're all really having trouble with X. Could we have a call? You never know. It might be possible. I'm sure Mandy would be more than helpful to get that facilitated. You are not currently doing quarterly reports in HMIS or on PDX, but that's not to say you shouldn't be doing them yourself. As I mentioned, if you and Robin tell me what your thoughts are on this one, I highly encourage, especially if you're a newer team or a newer person to a team, to run a report on a monthly basis until you get a feel for, okay, what I think I'm putting in is coming out the way I expect it to, versus oh gosh, no, I should have twice as many contacts. Why aren't they showing up? Where is it missing? Being able to reconcile what you think should be in there versus what is in there is much easier to do on a smaller scale than waiting, 6 months or a year to try to figure out where things are going wrong. Do you have some input on that, Robin?
Yeah, we do try to encourage our users to do that a lot. Reports are something that aren't as utilized in New Hampshire as we'd like them to be. So we try to encourage that a lot. Even like you said, down to data quality. We have lots of built-in data quality reports in our system that can show you, things that data points that you might have collected that you forgot to go back in and put in after that initial contact or the initial few contacts. So there's plenty of built-in reports to the system. And then we have other reports as well that we're happy to show anybody how to use and run so that you can be doing that checking as often as you'd like.
Perfect. Wonderful. And again, bravo, because that is fantastic. Your team is very initiated to go forward and move the data and use it in a way that's progressive and helpful. Keep in mind
we like
too,
to try to. Oops, I'm sorry. No, I was just going to say we try to get the buy-in as much as we can to make people understand how important the data is, because sometimes you're just typing information into a system and you don't really think about where it's going to go and how it's going to be used after that. So we try to get that buy-in from our users to teach them how important it is.
fantastic. And again, this is how we all have jobs. I mean, if SAMHSA goes to Congress and Congress is like, you know what? Didn't look as if you did really well this year. If that keeps up, we're just going to cancel off this funding. That's going to affect a lot of people. And while your little part might not seem like a big part, when all those add up, it obviously makes a difference nationally. So fantastic, Robin. And one other thing too, with the whole concept of the reporting, understand that other grants, if you don't work with other grants, have gotten to the point of not allowing you to make changes at the PDX level. So if you're doing an annual report and you're like, no, that's not right, let's change that number, you might not be able to do that for very much longer in PATH. My understanding is this year PDX is still allowing that, but many other grant programs, you must have the data fixed in your HMIS system so that when it comes out of there and you upload it into PDX, it's done. There is no changing. So please be aware that that is coming. I'm not sure how many numerically have already gone to that, but several have stopped allowing changes once it's uploaded to the federal annual reporting. Oh, so we talked about the annual report. We talked about some calls. We talked about some site visits. Basically, there are a lot of things going on with PATH, and this is all in addition to actually reaching out and doing the work. So keep in mind, there's a lot going on, but there is a way to balance everything. Next. So if you're using PATH Data Exchange, you already understand a lot of things on this slide, but just to review it, this is what PATH program from SAMHSA is using to do their annual reporting. Other grant programs use different places. We use PATH Data Exchange. This is the current linkage. When you get this PowerPoint, you'll be able to link on there. And as I said, you utilize the information from HMIS and upload preferably in the comma separated values. Now, just a quick question. Is anyone having issues, one, using HMIS, which doesn't sound so with Robin's team here, or two, uploading a CSV file? Uh-oh, Mandy's like, yeah, there might be some issues there.
There are some issues that are being worked through with HHRC. It's a brand new platform, so we're trying to be patient, but yes.
Okay.
On topic right now.
All right. The general thought process behind a CSV upload, for those of you who may or may not have used it, is you download in a certain format, the comma separated values, and then you upload that from your desktop into the actual PDX program. It sounds as if that's being worked on right now, which, you know, it's a brand new system. You got to expect some little kinks in it. And so I'm sure as you get feedback from HHRC that they'll be able to work on that with you. You use the PATH Data Exchange to complete and submit your annual report. And again, beware, Mandy's deadline might not be the same as what's on the annual reporting is due to SAMHSA by December 31st. Well, yeah, but let's think about that too. How many people are really in the office from mid-December till the end of the year? A lot of people take time off during that period. So when you start bumping back for different reasons, and we have 2 major holidays during that time as well, it makes sense that you probably are going to need the information to Mandy sooner. Communicate, as I said, and it sounds as if you guys are doing great on this one, with your HMIS administrator and lead agency to resolve your data problems. don't be afraid. My gosh, on this call alone, I've noticed that Robin is more than willing, and I'm sure the whole team that she has is very open to this, and they seem very engaged. Take advantage of that, because not all HMIS lead programs are like that. So please take advantage of it and make the best of your data. And of course, communicate with Mandy about any challenges that you have moving forward. Next. So the SPC. This is just in here, this and the next slide are just in here to show you that Mandy's not sitting around doing nothing. She has a lot of things from her level that she needs to respond to. She needs to make sure that you get the request for your intended use plan as soon as possible, because that's an 8-week period, and they don't really care to give you more than that 8 weeks. So she has to immediately get that, turn it around, add her little spaces that she needs to have filled in for her questions on the annual report from that A through N, plus any other initiatives from the state that they want to be able to collect data from, and add that and get that sent out to you pretty much in a day. So this is something, it's a very challenging time. She also needs to be updating and putting things into WebBegas, so that's another program she has to learn. And she needs to collaborate with you guys to get everything completed, reviewed, changed if necessary, and submitted. Next slide. In addition to that particular function of the year, everything. I'm not going to bore you with everything that's on here, but there's a lot else going on. And PATH, as you know, is not Mandy's only program. So please understand that she's a busy girl and she will do the best she can. She's always been very responsive to everything we've done with her. And I'm sure she's the same way with you. So if there's something going on, let her know. She may be able to use her connections in different levels. She's at the state, so she's going to be privy to some state initiatives or other grant funding potentially that's coming through that might be able to help you with certain needs. And that's where those site visits come into play, where she's understanding what you have, so that when she comes into contact with different things happening around the state, hey, this might be a good way to improve PATH or make the situation better so that PATH can do something differently and improve. So she has a lot on her plate, just know that. And your help with making her life easier is greatly appreciated, I'm sure. Next slide. When we talk about monitoring, as you saw at the beginning, there are certain things that are legislatively put into place, things that she needs to make sure are happening. 20% max housing, although that's not an issue for your state. She needs to make sure that, she looks at the trends that are going on. In my state, when I did PATH monitoring, I also looked at Olmstead plans. I looked at the Community Mental Health Services block grant plans. I looked at your past years of IUPs. I looked at your past years of annual reports and bring all that information and look at the trends with you. Well, why is this happening? What do you think is the cause for this? Is there something here that needs to be assisted? How's this working? Oh my gosh, you're doing so well at this. What can we do to teach other people to do this? How did you come to being able to do that so well? So that's the type of thing that goes on with the monitoring program. Again, it's interactive, it's feedback, it's supportive, it's meant to open the lines of communication and basically be a litmus test. While it's required for every program, but just don't let it freak you out for PATH. PATH is understanding. We just need to make sure, especially on the finance end, that you're doing things properly. Next. As we mentioned, why you're going to monitor these programs, all the different things that we discussed that are referenced, and Mandy was like, yep. What's going on? What can we do to help you if you need help? And how can we use you to teach other people? Next. As far as resources, excellent. So if you're new, or even if you're not, you may or may not know about some of these. So here we go. You have the Title V, which was dropped into the chat box and is also available on the website. The Title V is the legislative guidance for the PATH program. You obviously have Mandy and anyone that works with Mandy that might be able to give you some additional information. And I'm going to throw in Robin's team because they have a really good understanding as well. And they can give you some of that why behind the numerics and the HMIS system too. You have a PDX. Well, you did have a PDX resource tab. Is that up and running yet, Mandy?
Yes, it is.
Excellent. Okay. So in the past and apparently currently, the PDX resource tab is also a great place. Typically, there are things on there that are available. Well, we're going to get there in the next slide. Go ahead and go to the next slide. So your state path contact can give you things like priorities, calls, meetings. I'm sure that Mandy has an open door policy where if something's going on, you call. In Pennsylvania, I might have people call me and saying, does this person really qualify for PATH? They're experiencing this, and this is the circumstance. If they're staying there, does that count as, and what is definitely SMI for our state versus not? She can answer a lot of those things. She's also going to be the one setting up some trainings based on the things that she's heard and seen, and any meetings that need to be put into place, or conferences, for instance. So she'll be addressing your needs and also giving you some direction and resources. Next. The data exchange website that we were just talking about. That's why I said, let's go on. You should have some annual report materials. You should also have some PATH presentations that may be very helpful. Typically in the past, the PATH data exchange has had your FOAs and any tools that were created during that time. HHRC will probably be putting on any of the trainings that they do specifically throughout the year for PATH. You also should be able to find your legislation, your funding opportunity announcements from years past, so you can do that, reviewing and seeing how wording has changed and maybe a little bit of a shift in focus has changed. You should have some HMIS resources. In the past, they've had your current year's PATH HMIS manual from HUD, as well as any training specific to that year's annual reporting, as well as a PDX user guide for both the provider level and the SPC level. And you can also look at reports, and I'm not sure if that function's up and running yet, but if not, it probably will be in the future. Next slide. Your HMIS manual, please, 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 and I think Robin will agree with this, your PATH HMIS manual should be your go-to for a lot of questions. A lot of the information in the first two sections, well, minus the legislation, the HMIS related sections on this presentation were pulled directly from the HMIS manual. Know that it's there, and Mandy can help you understand it if you have questions on that. But it should, as I said, be also available on the PATH Data Exchange, and there is another version available in Spanish as well. Next. So there are many things here that you'll get when you go out and are able to get the finished product from the presentation today. You have WebBGS, you have point in time counts, Humless programs from SAMHSA and other resources. You have the SOAR website, which has amazing resources from all kinds of things, including that blue book of SMI samples and systems and criteria. So please feel free to use any of these. And the HUD Exchange is also fairly good. Anything else, guys? You've been kind of quiet, but I understand you just had a lot of training, and you obviously have very good resources and Robin's team and Mandy. So makes sense why you might not have a lot to ask.
And I did just want to highlight that this was very PATH heavy, right? This was PATH, this is what PATH is, this is what PATH does. So moving forward into the sessions on the agenda, for those of you that are not direct PATH, there are going to be sessions that are, let's say, case management and engagement. We have outreach and safety. So there are things that will still be focused around PATH without being so heavily into the PATH program. We just wanted to provide a foundation to understand what this program was. So I don't know if there are any other questions or comments or discussion.
But this would end this session for right now.